The world is facing critical challenges with the COVID-19 pandemic. It's affecting workplaces across the globe, and thus ensuring the safety and health of everyone is paramount. Information is continually being updated by the CDC and health organizations, and it's important that companies and individuals stay on top of recent guidelines and requirements. The information provided in this training is current only as of the published date. In this course, we're going to briefly discuss COVID-19 symptoms, what we know now, how to prevent COVID-19, and the steps to eliminate the spread, both at work and at home, and what to do if you're sick or suspect you may be ill. Please remember to follow your company's protocol on dealing with the COVID-19 virus. Symptoms. The symptoms of COVID-19 are varied, and information on these symptoms are continually being updated as new patient information gets reported. According to the CDC, reported illnesses have ranged from mild symptoms to severe illness and death for confirmed cases. Symptoms may appear 2 to 14 days after exposure. That's potentially a lot of time that can elapse, and a lot of other infected individuals if the prevention steps are not followed closely. Often, some of the most commonly reported symptoms of COVID-19 include a continual persistent cough, fever, loss of your sense of smell or taste, and shortness of breath. It's noted that older adults and people who have severe underlying medical conditions, such as heart or lung disease or diabetes, may be at higher risk for developing serious complications from this virus. But understand that anyone, any age, any level of good health can contract this virus. Much of the U.S. is on some type of stay-at-home order and only open to what is deemed essential business. As an employee, you may already be working remotely, still coming into an office or warehouse because your job duty is deemed essential, or you may be currently off. If you come down with any symptoms, you should follow company protocol, call into your employer, and stay home. It's vital that you do not put others at risk. But if you are a driver on the road and begin to feel any of these symptoms, it's a good idea to contact dispatch right away and report the symptoms. Either way, if you have possible or confirmed COVID-19, according to the CDC, you should do the following. Stay home from work, school, and away from other public places. If you must go out, avoid using any kind of public transportation, ride-sharing, or taxis. Monitor your symptoms carefully. If your symptoms get worse, call your healthcare provider immediately. Get rest and stay hydrated. If you have a medical appointment, call the healthcare provider ahead of time and tell them that you have or may have COVID-19. For medical emergencies, call 911 and notify the dispatch personnel that you have or may have COVID-19. Cover your cough and sneezes. Wash your hands often with soap and water for at least 20 seconds, or clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. As much as possible, stay in a specific room and away from other people in your home. Also, you should use a separate bathroom if available. If you need to be around other people in or outside of the home, wear a face mask. Avoid sharing personal items with other people in your house, like dishes, towels, and bedding. And clean all surfaces that are touched often, like counters, tabletops, and doorknobs, using household cleaning sprays or wipes according to the label instructions. How COVID-19 spreads. Although this is a new disease and scientists are still learning about how it spreads and its severity, the virus is thought to spread mainly from person to person and from contaminated surfaces. It can spread between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Prevention. As we said before, if you have to go outside or be around others, Maintain the social distance of at least 6 feet between others. The COVID-19 virus is also being shown to survive on surfaces for up to several hours, even up to several days. If working in an office setting or in a warehouse, disinfecting areas where others have been with a household disinfectant, such as cleaning wipes or bleach solution, can help eliminate the virus on contact. Think about all the areas, both inside and outside, where others have either touched or possibly even contaminated via sneezing or coughing. Desks, computers, keyboards, doors, handles, vending machines. If in doubt, sanitize it. Be sure you do not touch around your face after touching these areas or after sneezing or coughing without disinfecting first or thoroughly washing your hands. And regarding hand washing, it's important to wash your hands as often as possible with soap and water for at least 20 seconds. Also use hand sanitizer after touching any potentially contaminated surfaces, or if you have sneezed or coughed. It's also recommended that you only cough or sneeze into your arm or shoulder to eliminate spreading the potential virus to your hands and then onto other surfaces. And although there is some debate about the effectiveness of wearing a face cover, many experts are recommending, and some business requiring, the use of these coverings. All these tips will help to eliminate the potential spread of the COVID-19 virus and should be closely followed by employees. The COVID-19 virus is a real threat for all of us, and the worry that can come with handling your duties while friends and loved ones may be at home, stress about working conditions, or the threat of employment slowdown can all lead to further stress and lack of good judgment. In these times, it's more important than ever to remain vigilant and not losing focus in stopping the spread of this virus. Thank you for all your hard work, and as always, stay safe and healthy.